in general, pulsed electromagnetic fields, energy can't be created, energy can't be destroyed. It can only be transformed. And so even a cell phone, while the information's not good, will inductively transfer energy. So all pulsed electromagnetic fields inductively transfer energy to whatever the target tissue is. Beamer does the same thing. It does this with fairly low powers, up to 150 microtesla or 1.5 Gauss. And I want to share something because it's not just about the power. More power is better. Beamer also deploys a very unique waveform and patented signal. I say signal because Beamer is not just transferring energy. And when I say transferring energy, electromagnetic energy transferring to the body inductively or inducing microcurrents, picocurrents, nanocurrents within the tissue, enhancing not just the function of blood flow, but actually fully enhancing all cellular function down to the molecular level. Where Beamer really shines and where its patents are expressed and why Beamer is the only FDA Class 2 cleared low energy delivery within clearance for the FDA is because Beamer has shown through 26 years of research that through its signal, its patented signal, it's able to target the musculature of the microcirculation called the resistance vessels. Beamer targets the precapillary arterioles, the muscles within the precapillary arterioles, to not just contract or to dilate, but to functionally maintain a tone. And this is known as, well, in the medical literature, we call this spontaneous vasomotion, this autoregulatory effect. But I promise you, Lisa, there's nothing, how can I put it? There's nothing spontaneous about it. There is a rhythmical periodicity which is occurring, but science is just on the precipice of really getting in to understand this. So Beamer, the only other thing that I know that targets the resistance vessels on the planet are beta blockers, and that's a suppressive therapy, mainly delivered through individuals with hypertension. But Beamer supports the autoregulation of blood flow at a local level through the modulation of tone of thousands of miles we have of microcircular. We're talking thousands of miles of tone to keep within our body. It's kind of mind-blowing when you think of it. Let's start with fatigue. I mean, you've been in practice for a little while, a couple minutes. And the fact is, fatigue is the number one thing that walks into an office. Pain's not far behind, but fatigue is always present. And this is one of the first symptomatic expressions of overperforming without recovering. I mean, that's what we do. We get tired. And then what do? We go for coffee or energy drink or this or something to give that. Even exercise gives us that initial endorphin boost, but at what cost? Are we able to then recover and regenerate, or do we perform and degenerate? So I already kind of forgot the question you asked.
We're just talking about how the improving blood flow and oxygen helps with improving fatigue and
yeah. So back to fatigue. So fatigue is directly related to mitochondria, mitochondrial bioenergetics. So Beamer, by the name, before it became a vascular therapy, physical vascular therapy, Beamer was known bioelectromagnetic energy regulation to support energy transformation, so mitochondrial function. And as far as the reason we live, age, and die, we learned throughout medical school, physical therapy, that we oxidize, and if we don't recover from that oxidation, that degenerates that cell, that tissue. Then the cool story for the last couple decades was that oxidation story is true, but what about the story about energy transformation, mitochondrial bioenergetics? This is the hot topic. If you're not transforming, regulating energy in the appropriate way, then you don't clear out that oxidative damage, you live, age, and die. Well, as of 2019, there's been a publication called The Microcirculatory Theory of Aging by Kunlin Jin. And it hypothesizes in an incredibly accurate manner, from my perspective, that the reason we live, age, and die isn't just because of oxidative damage, isn't just because mitochondrial deficits, but literally the inability to maintain functional tone of the thousands of miles of these microvessels, these resistance vessels. They break down in their ability to maintain form and function before the heart, but we express disease in our heart because the little garbage trucks, the little muscles aren't doing their job. And a lot of it, it's not because they're programmed not to do their job. We're not allowing them to do their job. One, because we're not allowing for recovery. We're not sleeping big time or recovering in that way. Or we've programmed our brain to input or expect negativity as far as fear, whatever it might be, stress. I mean, whatever it is. And we never get to that place of remembering our that state where we can perform again. So it's like it's a feed forward cycle and a detrimental one as well. This tapes into under the bra, and it tests and looks at through a membrane how you're breathing. It will vibrate. It will even geolocate you where you are. And then you can go through and say, oh, I wasn't breathing well here while I was driving a car. I was at the light. And I said, oh, there must be more. I remember saying this to a patient. And I said, give me your phone. And I looked and I said, oh, you were on the phone with your mother. And what happened? What was the conversation about? And that way we can bring this back from just an unawareness to a conscious awareness where we can actually make a change and not just say, oh, I want to change because this showed me this. Get back into, well, why do I react to these situations versus respond? And when did that start? Otherwise, there's no way to get out of this loop. Our goal in practice is to go out of business as it relates to getting people better.
Sure.
It doesn't happen because really the root of healing comes from the vulnerability and how do I say, the openness, the receptivity to remember that state of consciousness or our health. And a lot of times we are so locked into our perceptions that we fail to remember really the greatness that's within us, not just on a level of exposure of doing things, performance, but what we're meant to be doing here and honoring that part too. They're using it in their training. For number one, they train with it. They train, so they boost their body before using it by using a specific level of program. And most importantly, and this is forgot by so many people, immediately after training, they're utilizing it to help bring their body back into a balanced state where then they can clear out the waste products from that performance at a more expedited level. And also that affects mindset as well, the zone. And so say you're a pickleball player. I'm going to give you something to use before the match differently than if you're a PGA golfer. And what I mean by that, if you're going out, Lisa, and you're going to the pickleball court, I'm going to actually probably run something up your spine, maybe a program 1 or something to give your body energy, and also just use the combination of the 10 and 30 hertz. But there's another program called the special program. And for that PGA golfer, I'm going to have him do, or her do, for the LPGA, a special program which only deploys the 10 hertz, which is an alpha stimulus. Why would I not do the other gamma stimulus 30? Because for a golfer, I'm going to tell them during that 20-minute segment before their match to visualize in detail the activity that they're going to be doing in that state where 10 hertz is coming through their body with the beamer signal. When you're in that state of actual performance, your body can remember that balance and stay calm. I call this tour hardened. You're out there, there's stuff going on, but you're in that zone state. And it will elicit a very similar thing on that pickleball court. When an individual is in that ready position, you're not on your heels, you're not on your toes. You can go anyway, left, right. And that's one of the cool things about this. Before your body moves, we're anticipating stuff constantly. And the better we can anticipate outcomes in life, the better we survive, to be quite honest. This was literally a life or death situation less than probably a couple 100 years ago.
Yeah.
Now it's like, okay, who can hit the ball quicker than the next person? But we have to stay sharp. And I don't mean getting ready, I mean stay ready. And when we're using Beamer, we're in that state of staying in a ready state, not crazy where I'm anxious, but in a relaxed state of readiness. And this has been proven through something called the zone, or being in the flow state, where, I don't know, there's some hallmarks where time seems to disappear. Someone's completely immersed in the task that they're in. From the outside, it may even appear that they're doing superhuman type of stuff. They're not. They're in a state of flow where they're able to almost anticipate stuff before the next person. You can't anticipate something accurately if you're blocked through anxiety or you're locked in depression. The only way to functionally anticipate life is to be neutral. And that's a really hard thing to be in today's environment.